Good afternoon. On behalf of the 6,000 employees, 1,500 physicians, and nearly 600,000 individual patients that we touch every year, I bring you our best from Grady Health System. I have spent a lot of years going to funerals for friends and others who have died from HIV and AIDS or from AIDS. Now we find ourselves in a new epidemic right here in Atlanta, Georgia. We want to be here and we want to respond to this epidemic. But on the other end of this epidemic, there are hundreds of heroes sitting right here in this room who are fighting the fight on the front line to make sure that we reduce the number of new cases of HIV. By the time the patient gets to us, it's really an advanced case of HIV and AIDS. I hope the work of the FDHA and what the FDHA has committed itself to today, which Tommy, Lisa, thank you so much for bringing attention to this issue, but that it will help ignite our community to do the work that we need to do to address the social issues, to address the access issues, to address those conversations that need to be happening from pulpits and institutions around our community, that we can influence those discussions and really bring this epidemic to an end, much like we did in the 1980s and 1990s. So I do have to say once again, I got to see Dreamgirls when I was 22 years old. And I got to see Cheryl Lee Ralph and company, and that's still a highlight for me. So I was ecstatic when I saw she was going to be here today. Thank you to each and every single one of you, and we are fighting the good fight to make sure that we maintain the funding that is needed to make sure that the patients we serve get the services they need. Thank you very much.
Good afternoon, everyone. The person who introduced me as Dr. Christine Green. So the first thing I want to do, because I do know so many of you in the room, and you were all impressed that I had made it to that level, that I wish that I had gotten that far, but I'm not a doctor. I'm the Deputy Chief of Staff for the Department of Public Health. And I bring you greetings today on behalf of Commissioner Pat O'Neill. Dr. O'Neill is our new commissioner. He's recently replaced Commissioner Brenda Fitzgerald, who has gone on to be the Center of the CDC, the Center of Disease Centers. I'm saying it wrong. Anyway, the director of the CDC. I was going to spell it out. But today the commissioner is giving the State of Public Health address to a convening of all the public health officials in the state of Georgia in Athens. So he sends his regrets that he couldn't be here today and gave me clear direction on what I should be saying to you. Okay, so Because the focus of this summit is HIV facts, faith, and myths, let the truth be told, Commissioner O'Neill has asked me to bring you the facts about what we in public health believe is the most important thing that you all should know as it relates to HIV in Atlanta at this time. The fact is, the statistics are alarming for young, Black, gay males. If current rates persist, half of our Black, gay, and bisexual men will receive an HIV diagnosis in their lifetime. This is not acceptable. The cornerstone of public health is prevention. Pre-exposure prophylaxis, or PrEP, which you spoke a little bit about earlier, and I was excited that you gave that prelude, is an HIV prevention strategy for individuals who are not a part of the statistics yet. PrEP has been shown to provide 92% to 99% reduction in HIV risk for HIV-negative individuals who take the pills every day as directed. Now, every day. Big ask, right? That's an important part of that message. More than half of the HIV/AIDS cases in Georgia are in the metropolitan Atlanta area. So it is imperative that the leaders and people of Atlanta join in spreading the word about PrEP and doing our best to prevent further spread of this disease. This is critical for the gay and bisexual men, but it is also critical for our women and our children. Georgia is above the national average for perinatal transmission of HIV, another unacceptable circumstance for this state. In females diagnosed with HIV, heterosexual contact accounts for more than half of the transmission. So it is critically important that when we continue to educate gay and bisexual men on the importance of continued condom use as well. These are big asks, but the message is clear and a difference can be made. We can prevent further spread. The Department of Public Health is very appreciative of the Grady Health System and the role it plays in public health and HIV/AIDS. We've worked together closely since the beginning of HIV to treat those infected individuals in need of assistance. And I can personally attest to this as I worked in the Fulton County Health Department, 99 Butler Street, used to be Butler, it's Jesse Hill Jr. Drive now. Way back when those very first HIV cases, AIDS cases, presented themselves, we opened the first Ryan White Clinic in the state of Georgia. And Grady was our steadfast partner. When cases got too difficult for the health department, they transferred to Grady. It's sad that that still has to occur, isn't it? But we have an opportunity now. Y'all, we have an opportunity to make a difference. Grady's working with us now on another one of the Department of Public Health's highest priorities, which is early brain development. During the first 3 years of life, the brain undergoes its most dramatic development, forming more neural connections in those years than at any other time period in their lives. 3 years, a baby till they're 3 years old. When this early development is not nurtured, the brain's architecture is adversely affected, and young children fall behind in their development and learning. Early exposure to language sets the foundation for cognitive ability, literacy, school readiness, and ultimately educational achievement. In Georgia, only 34% of students meet grade level proficiency at the 3rd grade. That's another, unacceptable for us. 3rd graders who cannot read at grade level are 4 times more likely to drop out of school before high school graduation. And we all know the difference literacy and a high school diploma make in your ultimate life outcome. The same is true for health literacy and health outcomes for chronic diseases, including HIV/AIDS. Public health needs community leaders such as you to spread this message as well, to start making a difference with our babies when they're born. This is not anything that's difficult. It's simply spreading the word that those little babies need their moms, dads, grandmothers, their support structure around them to talk to them. I always do this like I'm holding a baby when I try to describe it, but look at the baby, engage the baby, and talk to the baby. And every word that baby hears, the brain is building. The baby needs to hear the words in their native language as well as English, but the native language is the most important thing. We need these babies, we need our future generation to grow up strong enough of mind, make it through 3rd grade, graduate from high school, know what it means when we start talking about risks and words like prophylaxis and things like that. You have to build the next generation to be stronger in order to really, in the long run, fight the things in society that are against our children, that set them up for where they end up. Other high priorities for the department at this time include addressing the opioid epidemic and working on the establishment of a cardiac care system designation. We're hard at work at the state's public health concerns, and we invite you to join us by looking at our strategic plan to learn more, by contacting us to join you in your efforts to spread the word on HIV, early brain development, and really all of our priorities. And we thank you all so much for what you all do every day to support public health in the state of Georgia.
I know where my voice belongs. And today, I know for the most part, I'm talking to the choir. So choir, you've heard some lyrics, statistics today, which I hope we all now know we must learn to sing a new song. We have some very difficult work to do. And I'm going to take you back to the beginning. 35 years ago, which will be very difficult since I'm only 36 myself. What's so funny? December 20th, 1981, I made my Broadway debut in what has become the iconic musical of the 80s, Because I Say So, Dreamgirls. Dreamgirls was the best and worst of all times for me. The best, of course, was being the belle of the ball on Broadway. Anybody who was anybody came to see us on Broadway, including that man right there from Grady. They were all there night after night, and we created something called SRO, Standing Room Only. And for the price of $15, you could stand in the back of the theater to watch the Dreams do their thing. Oh, it was amazing. And I met everybody from Michael Jackson to Whitney Houston. She was only 19. Who else? Diane von Furstenberg. Let me see who else. Name somebody. That's right, I met them all. And in the midst of those good times came the worst. And that was when my friends just started dropping dead. They just started dropping dead of a mysterious disease. See, they got sick and they died. They got sick and they died. Some of them developed those strange purple marks on their bodies, and they died under stigma and shame and silence because nobody wanted to talk about that gay disease. And it was an ugly time because good people, kind people, people of all religions, faiths, and beliefs found it easy to cast judgment on people, saying that's what they get. That's what they deserve. God will take care of them. And what did the real good people do? What did the saints do? They remained quiet, and the silence was deadly. And America just couldn't wait to show gay people just how much they hated them. They would chase them down in the street and beat them with bats. You all remember gay bashing? That was real in America, and good people did that. Good American people. And guess what? It was okay. Because what did the good people do? They remained silent. Because that's what those gay people deserved. And let's not talk about when black folks started coinciding with the deaths. Remember, we were having our own problem with crack. Y'all remember crack houses? You remember the way people found it easy to make fun of crackheads? You know, how people thought it was okay to act like this was no real epidemic. After all, it was just young black folks. And what did good people do? They remained quiet. So 35 years later, what are we doing? The same old thing, because we're quiet. I dare say a lot of folks don't really care about those gay, black, young men. Did you just connect all those dots I laid out for you? So let me say it again. 35 years ago, America didn't care about gay people. Folks found it easy to drop their sick children off on church stair steps like bags of used clothing at a rummage sale. They found it easy to turn their backs on their children, on their father, on their uncle, on their friends. Like, oh, it ain't happening to me. Oh, that's not in my family. Oh, no, we don't have any of those people. Stigma, shame, silence. And they died a horrible death. And you would go to the hospital to look for your friends, but you see, there was no hospital bed for them. No. You would find them on a gurney, pushed out in a hallway, dying for help. But there was no help for gay men. 35 years later, you heard him tell you, we've got a new epidemic. Gay, bisexual, young, black men. And you know you hate them. You know you don't like them. You know their lives don't matter. You know they come through the door sick, indigent, vulnerable. You know what you already think about them. Because if you thought something different, something would be going on different, but it's not. You don't have to clap for me, because you don't have to clap for the truth. You don't have to clap, because it's hard for you to hear. It's hard for you to react. It's hard for you to care. It's hard for you to organize. It's hard for you to strategize. It's hard for you to help. It's hard for you, and you ain't sick. I always have to apologize to audiences and remind them, you invited me. So I don't know where we go from here. I don't know who are the people that value life, period. I don't know who are the people who stand up and say, do unto others as you would have them do unto you. I don't know who are the people that say, I just love you, because I don't know who those people are. Because I am confused. 35 years later, I never thought that I would see a time when someone would sit and tell me this is now a young person's disease. I hope we don't let ourselves become like continents, countries like South Africa, where the disease is systemic. That means it's just part of who the people are. And that can happen. But it doesn't have to happen if we care enough. And talking about care, health care is very, very important. Why? Because prevention is better than cure. Why? You just heard it. By the time people present at the emergency room, it's an advanced state of disease, and it is very expensive. It's $1,000 just to walk through the emergency door. $1,000. Wouldn't it be nice if we cared enough about human beings to make sure that we keep them healthy? Because sick people are very expensive. Don't add ignorance to it. Don't add ignorance to it. But then again, guess what? We don't care enough to keep people healthy. We don't care enough to educate people. I said it. She said it. That white lady right there said it. What's your name? Christine. Dr. Christine. Said, when the numbers are low for children and they get to the 3rd grade, she was nice. She said they are 3 times more likely to drop out. Well, guess what? They are 50 times more likely to go where? Prison. Prison. And when we don't educate them, guess what? They hit your children on the street and keep driving. They break into your cars for your phone charger, costing you quite a few $100s for your $5 phone charger. You know I'm telling you the truth, because y'all live in Atlanta. Imagine if we cared enough to keep people healthy. Imagine if we cared enough to educate people. Imagine if we cared enough about ourselves. It's like an old drag queen once said, if you can't love yourself, how in the hell you gonna love anybody else? Thank you.